was a phase 2 trial of atezolizumab in BCG unresponsive non-muscle invasive bladder cancer, the SWOG S1605 trial. This was a single-arm phase 2 trial, and patients were BCG unresponsive and had high-risk non-muscle invasive bladder cancer. This data is only for the CIS cohort. And total number of patients enrolled on this study was 172, and the ones enrolled on the CIS cohort was 74. Patients received atezolizumab as the treatment after BCG failure, and the primary endpoint in this study was complete response at 6 months, which was mandated as an endpoint by the FDA based on a biopsy at 6 months. Notably, in other trials in this setting, the primary endpoint was defined as complete response rates at 3 months. But in this study, it was CR rates at 6 months. In this study, they found that the complete response rates at 6 months were 27%. It did not meet the primary endpoint at the interim futility analysis. Interestingly, the unplanned secondary endpoint of complete response rates at 3 months was 42%, and it was comparable to pembrolizumab from the Keynote 057 trial, which led to approval of pembrolizumab in this setting. On this study, there was one treatment-related death. Overall, we have one drug approved in this setting so far, that is pembrolizumab, based on the Keynote 057 trial. There's another trial which showed a lot of promise, the intravesical Stelidrin trial, which showed that the complete response rates at 3 months were 53%. Now, that was not a primary endpoint of this study, but it did show 42% complete response rates at 3 months. Now, the key in this setting is that the gold standard has been radical cystectomy, and we really need to see long-term durability data of maintaining complete responses to see how effective a therapy would be. And the median duration of response so far for pembrolizumab is 12.7 months. And for this study, we don't have a long enough follow-up yet. But time will tell about the durability of responses.